Oral questions by members.
Leader of Official Opposition.
Thank you, Mr. Speaker. On International Women's Day, we recognize that women have faced far worse job losses from the pandemic than men. In fact, 27,000 fewer women have jobs today. One reason for that, Mr. Speaker, is that the women are highly represented in the tourism sector, which has been devastated, and which is the new subject of a new report released today by Destination Canada. They found, and I quote, "The current situation facing the tourism sector is the worst ever seen, more dire than the impact experienced after 9/11, SARS, and the 2008 economic crisis combined," end quote. This is a crisis. There's no other way to describe it. And yet, the Premier has failed to act on over half of the recommendations of his own Tourism Task Force report, including a very critical recommendation that would provide relief from fixed costs like government fees. 2/3 of the job losses in tourism are represented by women. Will the Premier implement all of the task force recommendations, and most specifically, the recommendation that would provide relief from government fees?
Minister of Tourism, Arts, Culture and Sport.
Thank you, Honourable Speaker, and happy International Women's Day. I appreciate the member opposite raising this important issue. Of course, there are no boundaries for this pandemic, and tourism has been devastated. The report highlights how it's impacted all of our postal codes. The limitations are in the sector because we can't travel. The borders aren't open, and we don't have the mobility that we enjoyed before the pandemic. On December 9th, we received the recommendations from the task force. It was a call to action from our government. We implemented the task force. We received the report on the 9th. And on December 22nd, we announced that more relief was coming strictly to the tourism sector because we know that the sector has been hard hit. It was a call to action. They wanted a grant, not loans, up to $45,000 to be available to those in the sector that have been hardest hit. 60% of our small and medium business grants have gone out the door to the tourism sector, and more help is underway. $5 million was dedicated to the Indigenous Tourism BC Association because we know that the pandemic has hit our tourism sector across Indigenous communities. We are working around the clock to implement the recommendations from the Tourism Task Force, and I appreciate the leadership from the Tourism Task Force. The industry told us what we needed to do, and we are responding because we value the importance of the tourism sector and the women that are working in this field to bring home family-paying jobs.
Thank you, Minister. Leader of Official Opposition on supplemental.
Thank you very much, Honourable Speaker. Well, tourism businesses can't keep waiting. And as the Minister herself describes it, it was a call to action. That means actually doing something. Before the end of this month, small travel service companies must pay the government nearly $800 in mandatory licensing fees, not some arbitrary collection of money. They owe the government money at the end of March. Travel businesses, as everyone in this House would recognize, have essentially been shut down. And instead of help, the Premier of British Columbia sends them a bill. Other provincial governments, including in Ontario and Quebec, have eliminated those fees. Yet this government has refused to do that despite it being a recommendation of the Tourism Task Force back in December. Over 75% of these travel businesses are managed and owned by women. So once again to the Premier, will the Premier implement all of the Tourism Task Force recommendations, and most specifically, Will he deal with the issue of paying fees to government, or will travel companies be forced to pay the fees to the government?
Minister of Tourism, Arts, Culture and Sport.
Thank you, Honourable Speaker, and I'd like to thank the member opposite for raising this important issue. We value, our government values, the importance of tourism across our province and all of our area codes. And of course, we value the importance of women in this sector. We all, every member in these chambers wants this pandemic to be over, and we are getting close to the peak. The vaccine is rolling out and our communities are going to be safer for people to travel. The member is not accurately reflecting the facts that we did move quickly on the recommendations. The member must appreciate you can't implement all the recommendations at the same time. That's impossible. But our ministry did work around the clock to respond to the biggest call to action, which is to get grants out the door, because they wanted grants, not loans. And our government has done other measures to help businesses with deferrals, with support, advocating with the federal government to ensure that we had that 75% wage subsidy to help people employed. We are working with other levels of government because we know how critically vital the tourism sector is. And is there more to do? Most definitely. And we will continue doing that work. And we will continue to work on the recommendations from the task force. So again, I thank the member opposite for raising the question, for her advocacy.
Member for Richmond North Centre.
Thank you, Honourable Speaker. I don't know why the minister doesn't think that paying the mandatory license fee is crucial. It's one of the most important recommendations. Just listen. I have letters from 68 travel agencies protesting this mandatory licensing fee and the premier's incompetence. They write, and I quote, "We have suffered an income loss of over 95%, and are desperately in need of any government assistance in order to survive," end quote. These businesses are on the verge of closing for good. Why is the Premier adding insult to injury by extracting these government fees?
Minister of Tourism.
Thank you, Honourable Speaker, and thank you to the member opposite for raising the question. On International Women's Day, we are going to lift up women and the important work that they do in this community. When we talk about insult to injury, it's insulting to say that the ministry, my staff, are not working around the clock to try to get resources out the door. No one called for this pandemic. We want this pandemic behind us, and there is light. The vaccine is coming. Grants have gone out the door. Grants will continue to go out the door. Not loans, but grants, because this was a call to action from industry. Just as we're investing in Indigenous businesses across the province, our government is investing in people because that's the business we're in. We believe in people. We believe that we need to be on the side of people so that when we can turn the switch and it's safe to do so and we can travel across our province and all of our area codes, that it's going to be safe. One of the recommendations from the task force is to ensure that we have certification for businesses so that consumers know that it's safe. That's what British Columbians are looking for. Good news is coming. Stay tuned, Honourable Member. We're going to continue doing that work with our ministry, but we can't move any quicker than we are because our focus right now, our laser focus is getting the grants out the door. Thank you, Honourable Speaker.
Member for Richmond North Centre on supplemental.
Thank you, Mr. Speaker. From the response from the minister, it looks like that the minister is not listening to the voice of the tourism sector. Let me try once again. Over 75% of these businesses are managed by women, and they are paying the price for this premier's incompetence. Lily Chiu of Orient Travel Center in Richmond says, let me quote her, "We haven't had sales since March 2020. We have had zero income, no income. The travel agencies need help. Every dollar of savings means a lot to our survival. End quote. Every dollar counts. But the Premier has done nothing despite the task force recommendations. Can the Premier explain to businesses like Lily's why they still need to pay these government fees?
Minister of Tourism.
Thank you, Honorable Speaker. Michelle Obama once said, when they go low, you go high. We have been trying to get a grant out the door. This was a call to action from the sector. It is a grant, it is not a loan, because we know how vital it is. It was a call to action for the sector to have money to pay for the rent, keep their staff. We're working and advocating with the federal government to ensure that that wage subsidy is in place so that people stay employed. We're working with the federal government to ensure that the highly affected sectors can support businesses across BC. Member, I agree with you. The sector is important. Empowering women is important. Let's not forget the investments that we made in childcare, the investments to support women to go to work, to lift them up. Our government is taking a whole of government approach, a holistic approach, to understanding that when we support women in the workplace, we're supporting them at home, we're supporting them in the community. Our government's going to continue doing that work. Thank you, Honourable Speaker, for the question. Sorry, thank you, Honourable Speaker.
Member for Saanich North and Islands.
Thank you, Mr. Speaker. Our drug supply is becoming increasingly toxic. January saw 165 lives lost due to the illicit drug toxicity in British Columbia. That is the highest ever recorded in January, and following the all-time yearly high we saw in 2020 of over 1,700 lives lost. 1 in 5 of those suspected deaths in January noted extreme fentanyl concentrations, the largest recorded to date, of up over 10% from this time last year. Over 700 lives have been lost since safe supply measures were announced in September. The promise of safer supply being prescribed through nurses has fallen short. Those trying to access prescription opioids through their doctors have been met with stigma. Their prescribed narcotics have been low potency compared to the street-grade fentanyl currently in circulation. It's not curbing their addiction. We must do better. My question is to the Minister of Mental Health and Addictions. There are gaping holes in our patchwork for safe supply. We need immediate, non-stigmatized, effectively dosed, and consistent access to save people from the poisonous drug supply. What many have shared with us is that safe supply needs to be a realistic alternative. If it's not, people will just return to the supply on the street. What specific steps has the minister taken to close the gaps in BC's safe supply?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. That border closures and social distancing requirements of the pandemic have exacerbated the overdose crisis. The number of deaths having been brought down for the first time in BC's history in the year 2019 is a tragedy. To be fighting 2 public health emergencies at the same time and to have such disastrously increased toxicity of illicit drugs has lost more lives this past year than ever. And to the families that have lost loved ones and to those that are working hard to save them, I just say I'm so sorry. I'm grateful to, for example, nurse prescribers who are stepping up, that we now have 30 new practitioners spanning out across the province in every health authority, that we have an increasing number of addiction medicine doctors that are working on developing the guidelines for safe supply, for expanding additional substances. Both medication-assisted treatment and safe supply is vital. And in every case, because this hasn't happened in Canada before, patient safety is at the forefront. So we continue to take our guidance from addiction medicine doctors who are working on prescriber guidelines, on the framework to deliver safe supply, but to do it in a way that keeps patient safety at the forefront. Again, my gratitude to those who are breaking new ground in Canada. No one else has done this. And thank you to the member for the advocacy. You're right, we are going further, and there's much more to do.
Member for Saanich North and Islands on supplemental.
Yeah, thank you, Mr. Speaker, and thank you to the Minister for the response. As the Minister noted, 30 registered and psychiatric nurses in our province were to receive, or to be trained to receive prescribing powers for Suboxone, a prescription opioid, and the alternative to the illicit street supply. And they were supposed to have this training and be in place by the end of February. Now, this is an important step, as the Minister noted, and one that is a precedent for jurisdictions in North America. But we are a province of millions, and the overdose crisis affects all communities. I'm happy to hear that these psychiatric nurses will be in communities across the province, but just 30 nurses with prescribing power after nearly 5 months after safe supply measures were promised does not reflect the urgency that's needed to support drug users in British Columbia. Allowing for greater access to one prescription opioid alternative does not reflect the diverse range of substances used in this province, nor the efficacy of providing pharmaceutical-grade versions of illicit substances that reduce reliance on the toxic street market and can save lives. My question is again to the Minister of Mental Health and Addictions. I just want to confirm that those nurses that were promised are in place and have received those prescribing powers. And how is the Minister supporting the expansion of access across the province?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Meeting on Friday with the First Nations Health Authority, they were able to report that they have nurse prescribers in some of their communities already. These are people that were trained in early February. So that access, particularly to remote and northern communities, is particularly welcome. That was just the first cohort of nurses that were trained to be medication-assisted prescribers. This isn't the same as safe supply, although that is our long-term hope. But that guidance is still being developed by the medical community. This isn't a question of what's happening inside the ministry. This is the work that doctors and medical professionals are doing to ensure that the right types of medications are included in the guidance and that the guidance supports both patient safety and prescribers. Again, in Canada, we are breaking new ground on this. We are taking new trainees all the time, and the additional guidance that dictates how the medical community will make decisions about what type of medication-assisted treatment or safe supply is delivered to people with addiction use disorders is something that is entirely in the hands of the medical community. We are working as fast as we can to expand that work, to support that work, because it can save lives.
Member for West Vancouver Capilano.
It's not just travel service companies that are suffering because of the Premier's bungling. The BC Hotel Association says 46% of properties report that if they don't receive access to government-supported financing, they will not stay in business past the end of March. Internal numbers from the Ministry of Tourism from 6 months ago paint an even bleaker picture. An internal ministry document says, quote, 68% of hotel and resort firms need additional funding in order to survive the next 6 months, end quote. So my question, why is this Premier standing on the sidelines when nearly 70% of hotels, which employ so many women, are about to close their doors?
Minister of Tourism.
Thank you, Honourable Speaker, and thank you to the member opposite for the question. Of course, we recognize how deeply impacted the hotel industry has been, the hospitality industry has been, the tourism industry has been, because we cannot travel. We don't have the mobility that we once had before the pandemic to invite international visitors, because our laser focus at the moment is to focus on everyone's health and safety. Our focus is on making sure that we get the vaccine rollout and that people are safe and ready to travel. And what my ministry is doing with the sector, listening and working with this industry, is to make sure that we are ready to turn the switch when it's safe to do so. And this means being responsive. One of the things we recently announced, Minister for Jobs, Economic Recovery, and myself, was to amend the criteria so that the tourism sector would receive up to $45,000 in a grant. That was a call to action that I'm very proud our government was able to do. It was a call to action in the task force, the tourism task force that the Premier initiated, and there's more to do. We are calling on the federal government to support the sector. One of the programs, the highly affected sectors credit sustainability program, is going to help businesses with $1 million loans. There is help on the way. We recognize that the industry has been hard hit, and we look forward to the day that people can travel and occupy those buildings and support those people that are vitally important. I know.
Thank you, Minister.
Thank you, Honourable Speaker.
Member for Cariboo North.
Thank you, Mr. Speaker. 82% of hotels in British Columbia are small and medium-sized businesses, and 60% of their workers are women. And according to the BC Hotel Association Pulse Check, only 2% of the properties reported being eligible for the Disastrous Small and Medium-Sized Business Recovery Grant. How many of this province's 104,000 people working in hotel jobs, so many of these workers and people being women, will lose their family supporting job forever before the Premier will take action to help them?
Minister of Tourism, Arts and Culture.
Thank you, Honourable Speaker. And speaking of women, half of our cabinet are women. Half of our cabinet are going to work each and every day to support childcare, universal childcare, so that women have the empowerment that they need to help with our economy and bring that important work that they do as small business owners. We value the sector. There's no question, and I appreciate the advocacy on behalf of the member. We know that the tourism sector has been hit hard at every postal code across this province, which is why we amended the small and medium-sized business grant. $45,000 is available to them. Encourage your constituents to apply for that money. Encourage them to apply for the wage subsidy program with the federal government. Encourage them to work with the Indigenous Tourism BC Association to access those grants. And let's not forget that we've also committed to infrastructure programs and making it safe for the tourism sector to be ready to go when we can turn on that switch and it's safe for people to travel again. But Honourable Speaker, I want to remind the member opposite that we deeply value the tourism sector. We value the important work that women are doing. We believe on this side of the House, lift as you climb.
Thank you.
And you do that by giving people the tools.
Member for Cariboo North. No, okay. Member for Kelowna Mission.
Thank you, Honourable Speaker. I'm really glad that the Minister has been talking about the grants, because we've been asking about this very thing. You see, last month, the Premier was asked about his government's mismanaged Small and Medium Business Recovery Grant. And the Premier said, and I quote, "We're looking at how we can get those dollars out the door by the 31st of March. We need to spend the money by March 31st, or it goes back into servicing the public debt." End quote. So imagine everyone's surprise that the botched program has been extended to August 31st. As usual, the Premier got his facts wrong and displayed his incompetence. So how can the tourism industry have any confidence in a Premier who was this wrong about his own botched grant program?
Minister of Jobs and Economic Recovery and Innovation.
Thank you, Honourable Speaker, and appreciate the question from the member. The theme seems to be about the challenges that women are facing in the pandemic, and that's certainly the case. Dr. Henry uses the saying that we're all in the same storm, but we're all in different boats, and that's certainly the case in this pandemic. The impacts are being felt differently by different people, and women have certainly felt that. We know that women of color, Black, Indigenous, and new immigrant women have felt it more than women overall. So, Honourable Speaker, we're proud of the grant program, and I know tourism is the line of question today. There's no province that's offering grants as high as we are for tourism operators. There's no other province. The next closest is $20,000, and we're offering $45,000. I know my colleague, the Minister for Tourism, Arts and Culture, is working closely with the tourism sector to find the solutions, but so far, they've appreciated the cooperative approach we've taken. We've listened, we've adjusted our programs according to feedback, and we're going to continue to do that as the pandemic changes, Honourable Speaker.
Member for Fraser-Nicola.
Mr. Speaker, this government's incompetence is all around us. Last summer, the tourism sector called for $680 million of relief, and the government hasn't been able to deliver even a fraction of that. An internal document from the Ministry of Tourism reveals, quote, due to the timing of the recovery plan's announcement, the terms of reference for the Tourism Task Force were not finalized prior to the writ of election being issued, end quote. And the same document shows, quote, due to the interregnum period, the Tourism Task Force was unable to consult during the month of October, end quote. Will the Premier admit that he stalled recovery efforts, and will he fix it by providing tourism businesses with the relief that they have repeatedly asked for?
Minister of Tourism.
Thank you, Honourable Speaker, and thank you to the member opposite for the question. Our government asked and put together the task force representative of those leading the industry, First Nations leaders, labor leaders. They put forward a final report to us on December 9th, and on December 22nd, we announced that we were amending the small and medium-sized business grant, which was a call to action, the biggest call to action from the task force for us to make sure that those dollars go out the door. And as my colleague just mentioned, the Minister for Jobs, Economic Recovery, Innovation mentioned, this is one of the biggest grants across the country. There is more to do. We were responsive to the request for more funding for the Indigenous tourism sector, one of the fastest growing sectors in the province, and we'll continue being responsive. There's a call to action to make it safe and have a certification program so that consumers know that when they go into any facility that we've got the highest test of safety and cleanliness and all of the other COVID protocols that WorkSafe is calling for, directed by the PHO. We're going to continue being responsive because we know how valuable the tourism sector is to BC's bottom line, to all of our economies, to every postal code across this province. We want to make sure that the light switch is ready to go on when we're safe to travel across our province and invite visitors to travel across BC. Thank you, Honourable Speaker.
Member for Surrey South.
Thank you, Mr. Speaker. Well, I think that's cold comfort to most of the tourism folks in the province. There's a lot of rhetoric there and not a lot of answers about how they're going to support the tourism sector. But let's move on a little bit, because it's a very known fact that BC has one of the worst, if not the worst, gender pay gap in the country. The Premier has a chance to fix it. The pay equity bill that I tabled is still sitting on the order paper, and the Premier can call it for debate. Will he call the bill?
Minister of Finance.
Thank you very much, Mr. Speaker. And we have taken significant strides as a government towards gender equality. And the pandemic, for sure, it has highlighted really how much further we absolutely need to go. How much further we need to go as a government, how much further we need to go as a society. We do know that women make up a greater proportion of the lower paid service sector jobs that was hardest hit at the beginning of the pandemic. And I know that everyone in this House agrees that all workers, regardless of gender, should be paid the same. Whether you're a man or a woman, doesn't matter how you identify, you should get paid the same. And we've taken significant historic steps as a government to close the wage gap. Our investments in childcare have been absolutely significant and probably the most impactful to close that wage gap. We've raised BC's minimum wage and server wages, where the majority of workers are women. And certainly providing support to women in skills trades so that women can access greater number of good-paying jobs. And we know how critical that is going to be for our economic recovery. We are absolutely focused on making women's lives better, and we're going to continue to close the wage gap. And the member has brought forward a bill, and I think it's important to recognize that the nature of that bill, 98% of businesses in BC have fewer than 50 employees. So the legislation that she's proposed wouldn't really affect the vast majority of women, Honourable Speaker. So we're putting our attention on a broader view, recognizing that there are many ways to facilitate women having good-paying jobs in the workforce, and making sure that we are addressing all the systematic barriers that impact on pay equity. There's absolutely more work for us to do, and I look forward to talking with the member going forward and making sure that we're continuing to address this ongoing challenge.
The bell ends question period.